Looking for a place to watch all the games with your buddies this football season? You've got to stop by Long Neck Sports Grill. There are 3 locations, each one of them with 4K TVs all over the place, and the sound is always on for the big games. And you've heard me talk about Long Neck's menu, but have you tried the wings? What are you waiting for? And no place has a better beer selection than Long Neck's. And don't forget, Long Neck Sports Grill is also home of the Roundtable Show. Wilder, Hebron, and Richwood, each one of them awesome. Long Neck Sports Grill. This football season, stay late. Come often. Bengals game plan tonight from 6 to 8 live on ESPN 1530 FC Cincinnati on the road, north of the border in Montreal. To play Montreal, the game airs tonight on Fox Sports 1360. We do this on Wednesdays. We talk injuries, mainly NFL injuries, with one of the experts from OrthoCincy's Orthopedics and Sports Medicine. OrthoCincy's has specialists and locations all over the tri-state, and they offer walk-in orthopedic urgent care. Walk in at 5 tri-state locations with extended evening and weekend hours in Edgewood and Anderson. You can learn more at OrthoCincy.com. That's OrthoCincy.com. We're obviously going to start with Joe Burrow. Dr. Adam Metzler is with us. This calf injury continues to be an issue. Why are injuries like this so difficult to treat, and why is it so hard to pinpoint when an athlete could be back on the field in game action?
The challenge is obviously, or really unobviously, is really what's the muscle doing? How is it healing? If you have a surgical issue, we can address that and fix something, such as a fracture. We put a plate on it, or you tear your meniscus, we fix it. With muscle strains, is they have to kind of heal naturally on their own. You don't stitch muscle to muscle, so you're reliant on that muscle to heal and recover. And based on the type of tear, the different grades that there are, and grade 1 being mild to grade 3 being a complete tear of the muscle, they can take different time frames to recover, and also dependent upon each person. You're talking about high-level athletes doing high-level activities, and that's why time frames are very challenging and difficult, and each athlete is taken in its own time frame.
Are we supposed to just accept that this is going to have to be something that he's going to have to play through and linger all season long?
Again, that's very unpredictable. I wouldn't want to say that, because he may feel great in a few weeks and not have any lingering issues. And that may be the snare, or it could be an injury that he it nags him the whole season. And we see this with quad muscle strains of the thigh, or hamstring muscle strains, or calf muscle strains, that we have high-level athletes in the NFL and other sports playing through injuries, still performing well, but in the background they may still be hurting while playing. And that may be the scenario. Joe seems to, elicit a pretty strong behavior of returning and playing even with a little bit of pain. So I imagine he's going to want to try to play through this when he can. If it's going to affect the performance of the team, I think they'll make a change, but it sounds like he's going to play through this.
What can you do? Let's say they're going to try to get him on the field on Monday night. What can you do to mitigate the pain so that he could play effectively?
I mean, they're going to be working pretty hard from a therapy regimen, stretching like crazy, trying to keep them stretched out. And you can use the Theragun treatment as well, but you're going to be doing maybe ultrasound type treatment and a lot of calf stretching and keeping them rolled out and just trying to keep it from getting contracted and inflamed. And using an anti-inflammatory like your ibuprofen or medications like meloxicam can be helpful just to reduce inflammation. Sometimes we even use oral steroids like prednisone as a way just to help reduce inflammation. But those are things they'll be working hard for, alternating between ice and heat depending upon how he's feeling during his participation in game. And those are regimens that we can use to try to get athletes on the field as soon as possible.
I think, unfortunately, a lot of us have been thinking about Joe Burrow in relation to Aaron Rodgers, who, if you go back to the preseason workouts, he suffered a minor calf injury. And then, perhaps coincidentally, perhaps not, 4 plays into his Jets career, he tears his Achilles. Is this a connection we should make as it relates to Joe? Is this something we should worry about? What are your thoughts on that connection?
I mean, typically we'll separate those as separate entities. I mean, unfortunately, tearing an Achilles ends the season and is a long recovery. But there's not a necessarily direct correlation between calf strain and tearing your Achilles, but that's a little bit of, mileage on that ankle and, bad luck too. So I wouldn't have any direct correlation with a simple grade 1 calf strain and a complete Achilles tendon rupture.
Okay. Let's stay in the NFL. Let's talk about Nick Chubb of the Browns, who suffered an injury on Monday Night Football that was apparently so gruesome, ESPN and ABC refused to show it. It was shown on the video board at the game, and so there is video of it out there. When you see something like this in real time, he's done for the season. He injured the same knee that he hurt when he was in college, and he had knee reconstruction. He says he's going to get several opinions before making a decision about surgery. When you see something like this happen in real time, what are your immediate thoughts?
Yeah, I mean, these are catastrophic injuries, and they can be limb-threatening. So we get very concerned, and I've been on the sideline 17 years for football, and when you see that injury, the first thing that we worry about is making sure that the joint is back in place right away and that they don't have a knee dislocation. And by definition, if they tear 3 ligaments, it's considered a knee dislocation. But you want to stabilize the knee immediately and some type of knee immobilizer, making sure they have good pulses. And oftentimes those patients will go to the emergency room urgently. We'll check certain variables to make sure there's no arterial injury. There have been instances where even NFL players have had this type of injury, and they've had popliteal artery injuries, which is a artery behind the knee, and required to have grafting or repair of those arteries, and that can be limb saving. So we focus first on making sure that the pulses are there and that the leg is getting perfusion or getting a blood supply, and then stabilizing and immobilizing that leg to prevent it from being unstable. From there, once we have confirmed that they're stable from a blood flow standpoint, we'll then get MRI, and we'll work from there and see what ligaments are torn and kind of walk through the phase. Each scenario is different depending upon which of the 4 ligaments are torn, specifically ACL, PCL, and then your collateral ligaments are MCL and LCL. And so we would determine surgical proceeding based on what was torn, and kind of work with the athlete from there.
Having been on the sideline, you see something happen in real time, you rush out to treat the athlete. In a situation like this, walk me through those critical early steps. What's most important?
Yeah, again, the first thing is making sure his knee's not dislocated out of socket. From there, we're going to put him in an immediate immobilizer immediately, and those are the patients that we typically take to the ER that night to get additional testing, x-rays, make sure the knee is in socket on an x-ray, maybe even a CT scan, and get a pretty urgent MRI. And then that's also where we do special vascular testing to make sure there's appropriate blood supply. That's the process and progression of that type of athlete with that type of injury versus an isolated ACL injury that's fairly stable. Those can be temporized with icing, bracing, and be seen even the next day.
You mentioned before, he has dealt with a major knee injury, go back 8 years when he was in college, dislocation, 3 torn ligaments, there was cartilage damage, they had to do knee reconstruction. How much more worrisome is this injury based on his previous history?
I mean, this is one of the situations where you would get multiple opinions too, even as a physician, because he's had previous ligamentous repair, and there's a lot. He's got previous screws put in. He, depending on what graft choices they use to make and reconstruct those ligaments, there's a lot of variables. But these are tough to recover from the first time. Very few athletes make it back at that level with 3 ligaments injured. Obviously, Nick Chubb is just a phenomenal athlete, and kudos to him on all the hard work the first time. And hopefully with revision, reconstruction, surgery as necessary, we can see him out in the NFL, because no one wants to see that injury. That's a bad injury. So, good luck to him in his recovery.
No, gonna be rooting for him, no question. Dr. Adam Metzler from OrthoCincy's is with us. I want to talk about a Cincinnati Red and a guy that I've watched his return from his second Tommy John surgery. He's a guy that I root for, and when he's at his best, he's a very good pitcher, Tejay Antone. So he makes the comeback. He's back on a big league mound. He is pitching well, and then last week he's taken off the mound by the trainer. And when you're dealing with somebody that has TJ's injury history, you can't help but assume the worst. He has been at least publicly diagnosed with elbow tendonitis. That injury at face value, walk me through the typical recovery for that injury before we talk about his previous history.
Yeah, just elbow tendonitis, regardless if he hasn't had any other Tommy John type surgery, other UCL injury. They're going to shut people down. They're more aggressive than they have been ever, just because tendonitis may be a precursor to tearing your ulnar collateral ligament. So they're going to go through the process and shut him down, get the inflammation reduced with, anti-inflammatory type medications, things like that. And then get his elbow moving and some physical therapy, et cetera. And then when he's minimally symptomatic or not symptomatic, they'll do some bullpen stints and hopefully he's able to, get back and make it up and be able to participate here and hopefully a playoff run. But, again, the situation's very unique. Every pitcher is different. Some people have tendonitis that lasts their whole season, and some people just it's one time. And, and they're fine. But for other athletes, it can be something that lingers.
How much more is this eyebrow raising given the fact that he has had 2 Tommy John surgeries?
It's certainly more. I mean, this makes it much more concerning because you've gone through 2 previous surgeries, 2 ligamentous reconstructions, 2 surgeries in that area. It tends to potentially be more irritated or inflamed secondary to the fact that there's been 2 surgeries there. So, I mean, if you failed 1 Tommy John surgery in the past, which he obviously did, to have a revision Tommy John surgery makes everybody more nervous. I mean, it took him almost 2 years to kind of even get back out there after these surgeries. So, I think it's challenging, and pitching through some pain down the stretch, to help a team win is one thing, but if it results in another Tommy John surgery, then I'm not sure they'll see him back out there in the future if he has 3 Tommy John surgeries. But that's what we're not hoping for. Hopefully just a little bit of mild inflammation. Sounds like the MRI looks pretty good otherwise with an intact UCL reconstruction, Tommy John reconstruction, that is. So hoping for the best and a quick, speedy recovery here to get him back out.
No question about that. Excellent insight as always. We'll chat soon. Thank you so much.
Yeah, take care. Have a great day.
You got it. You are the man. Dr. Adam Metzler from OrthoCincy. The great thing about OrthoCincy is they have specialists and locations all over the tri-state. This includes walk-in orthopedic urgent care during the week from 9 a.m. to 9 p.m. and on Saturdays, 9 a.m. to 1 p.m. in both Edgewood and Anderson. It is easier, mainly because you don't need an appointment and also because it's cheaper than going to an ER whenever you have an urgent orthopedic injury. Go to OrthoCincy.com. That's OrthoCincy.com. And wanted to mention this very quickly. In Anderson Township, OrthoCincy Orthopedics and Sports Medicine is going to be opening their newest location on Beachmont in Anderson this Sunday. They're going to have an open house, which means refreshments, games, giveaways, and more. It's the OrthoCincy Anderson Open House this Sunday. You can get details at OrthoCincy.com. If you're a football fan, you've got to stop by Long Neck Sports Grill. There's no better place to watch all the games with your buddies, whether it's college or pro. There are 4K TVs all over the place, and the sound is always on for the big games. Long Neck's menu is awesome, and you've got to try the wings, and you're not going to find a better beer selection than what they've got at Long Neck's. Plus, don't forget, Long Neck's is also home of the Round Table Show. There are 3 locations in Northern Kentucky, Wilder, Hebron, and Richwood. This football season, Long Neck Sports Grill, stay late, come often.